Well, after weeks of criticism, the Ford government dropping a major announcement saying schools across the province will remain closed for in-person learning until after this April break.
We know that the more COVID spreads in our communities, the more likely it is to get into the schools. We will keep a constant eye on the data to determine when we can get kids back in the classrooms.
Prior to the April break, more than 99% of students and staff did not have an active case of COVID-19.
No word yet on when students could be returning. The province is expected to decide based on COVID-19 data and community spread. Yesterday, Ontario reported just over 4,400 cases. Premier Ford will be providing an update on Ontario's vaccine rollout this afternoon at 1 o'clock, and you can watch that live at citynews.ca. Joining me now to talk about the government's latest education move is COVID organizer or co-organizer, of the Ontario Parent Action Network, Jess Lyons. Good morning, Jess.
Good morning.
Well, obviously, this was a major announcement yesterday, not necessarily expected after everything that had been said to this point. What was your first reaction when you heard it?
My reaction is a mix of relief and anger. You know, this is a closure that's very much needed, but it was so preventable. You know, this is the second time now we've seen really negligent and incompetent Ford government sleepwalk us towards a case count that is really, before we have it, it's unimaginable. And so it needs to happen because we need to prevent avoidable illness and death. And, you know, we're so stressed out about, you know, the new variants, which we know now, affect children more significantly. Transmission is so much worse. And we know that, you know, long COVID, it's now clear, is a real significant issue for many children. About 10 to 15% of children who have COVID experience long-term effects, such as neurological deficits. So, you know, this all could have been avoided, and it should have been avoided, and it's really on the government.
Let's talk a little bit about the discussion that happened in the wake of this announcement yesterday. Obviously, the city and the province was abuzz yesterday. Every parent had something to say. What have you been hearing through everything that, or all the contacts that you have?
So there's some top things that we keep hearing over and over. Honestly, I think that the stress level was mounting on a daily basis for the last number of weeks as things began to really skyrocket. And I think that there was a lot of concern that the education minister and the premier were ideologically committed to keeping schools open, for their reputation, for political reasons, and were just ignoring the advice of epidemiologists and science experts who were begging and pleading and getting more and more loud and angry about what needed to be happening. And closing schools is a consequence, and it's necessary. But it's because the government keeps refusing to implement important public health measures. And this is what we're hearing from a lot of parents now is where are the paid sick days? What is holding this government back from implementing an absolutely vital, life-saving public health measure such as paid sick days? You know, we released demands in a report in consultation with parents all over the province last summer leading up to September, demanding ventilation improvements, smaller class sizes, so that we would stand a chance of keeping kids in class and staff in the schools healthier and safer for the whole school year. And, they didn't do those things. There was a lot of press conferences and a lot of talk, and it didn't result in any significant and concrete investment in the health and safety of our school communities.
Just there's been lots of discussion, at least over the last few days, the last week, about making sure teachers are getting vaccinated and they're among the essential workers. Do you agree?
Oh, of course I agree. I think that when we saw the announcement that finally came about 18 plus in hotspot zones accessing vaccines, that should have been happening. There should be the infrastructure. Public health units need to be funded and informed in advance so that they can actually implement these kinds of policies. What we need is actually more significant, unfortunately, closures right now of reevaluation of the essential industry list, and those workers need to be supported significantly by the province while their workplaces are closed so that they can be vaccinated. Every worker deserves paid sick days, deserves to access a vaccine in a reasonable timeline, and deserves to be given the adequate PPE, including N95 masks. It's now clear this is an airborne virus. So ventilation and crowded indoor congregate settings are the most important settings that we need to be managing. And so that means that we need some drastic measures. And that also means that communities and workers need significant support and relief while those measures are being put in place.
You mentioned timeline. Obviously, no one knows when we're getting back to school, but Jess Lyons, thank you for joining us this morning.
A pleasure. Thank you. Take care.
Jess Lyons is from the Ontario Parent Action Network. I'm not sure how busy they are outside at this point with the stay-at-home order and how everything is happening. What do the roads look like, Stephanie?